recognize the honourable member for Dartmouth South.
Yeah, I'll keep my comments quite short. I do think, of course, that we all agree in this House, and as my colleague pointed out, we had this conversation not long ago at all, that people should not face intimidation or fear when they are trying to access vital health services or when they're going to work in a healthcare facility. Again, I will reiterate that our healthcare workers have done far more than ever should have been expected of them and continue to do so during the pandemic. But I also want to flag, I was listening to a conversation recently with Dr. Françoise Baylis, who's a quite well-known medical ethicist and I think recipient of the Order of Canada, and she said that when she hears about programs concerning health, that the first question she asks, no matter how popular or well received the program is who will this harm? And that she takes that as her jumping off point of looking at the issue. And so I will register the same kind of concern that any time we put forward legislation in this House that limits people's rights, particularly charter rights like the right to free assembly and the right to protest, we need to make sure that we're doing that in a justifiable and minimally impairing way. There's been some mixed messages on this bill, and so we will look forward to an amendment if it comes forward, and also to hearing from folks at Law Amendments. But to that end, I think the notion of consultation is very important when it comes to legislation, and traveling across the province and having conversations is good, and showing up in people's place of work is good. But it's not only, with any legislation, there's unintended consequences. So it's not only healthcare workers and patients that are potentially impacted by a bill like this. There are many others, people who, again, are just exercising their right to free expression, to make their opinion heard among them. I have no time for folks who disagree with science, but I do have a great deal of respect for our charter, and so I want to ensure as we go forward in the legislative process that this legislation has been carefully thought through in that regard. I will say that the bill itself looked quite familiar when I saw it, and we did go through that process. But we will continue to review what other provinces are doing, and I'm certain at Law Amendments we will hear from healthcare workers and patients, likely from labor unions and other folks who will have a say on, how this bill does or could affect them. But I want to thank the government for bringing it forward. I think it is timely, as has been said. It's something that's happening across the country. As we pointed out in question period, we want to make sure that everyone gets vaccinated. I mean, this is the timeliness of this bill. This is clearly where this bill is directed. And so to that end, we are very supportive, but we remain open and somewhat concerned about unintended consequences. So provided that we are satisfied that those aren't there, we will be happy to support the bill. Thank you.
The honourable member for Argyle.